guys, and welcome back to this segment on our channel called Answering Your Most Googled Medical Questions by Hattie Gastro, and today's video is a super interesting one, so let's get started. So in today's video, we'll explore the development of myocarditis and pericarditis following vaccination with the COVID-19 mRNA vaccines. So on May 26, 2021, the COVID-19 subcommittee of the World Health Organization issued an international statement with regards to reports of myocarditis, which is the inflammation of the heart muscle, and pericarditis, which is the inflammation of the lining around the heart, following vaccination with COVID-19 mRNA vaccines. And on June 23, 2021, the US Centers for Disease Control and Prevention Safety Committee said that there was a likely association between the Pfizer-BioNTech and Moderna COVID-19 vaccines and the development of myocarditis and pericarditis in some individuals. So myocarditis is the inflammation of the myocardium, which is the muscles of the heart. When someone has myocarditis, the heart muscle becomes thick and swollen, causing chest pain that can feel like a heart attack, fatigue, muscle aches, diarrhea, rashes, leg swelling, pale, cool hands and feet, rapid breathing, a rapid heart rate, and fainting. So similar to myocarditis, pericarditis is the inflammation of the heart's pericardium, or the outer tissue that surrounds the heart. The pericardium's job is to hold the heart in place and help it work properly. It's actually made up of two thin layers separated by a small amount of fluid to reduce friction as the heart beats. Symptoms associated with pericarditis include chest pain, which usually feels sharp and gets worse with breathing and feels better when sitting up and leaning forward, a fever, tachycardia, which is an increased heart rate, and shortness of breath. So available information now indicates that cases have occurred mainly in adolescents and young adults, more often in males than females, more commonly after the second dose of the vaccine has been administered, and typically within several days after vaccination. But that most cases appear to be mild and are responding well to conservative treatments such as non-steroidal anti-inflammatory drugs and rest. The first reports of a small number of cases of heart inflammation after the Pfizer vaccine came from Israel at the end of April 2021. And on 1st of June 2021, Israel's health ministry said that there was a probable link between the vaccine and the myocarditis cases. And a total of 275 cases of myocarditis were reported in Israel between December 2020 and May 2021, among more than 5 million vaccinated people. And most of these cases were reported in men aged between 16 and 19, usually after they received the second dose of their vaccine. To date, no country has suspended the use of COVID-19 mRNA vaccines or change their vaccine guidance policy. And all countries who are using mRNA vaccines in young adults and adolescents are continuing to recommend their use, but are following the emerging evidence on this topic very closely as further information is being collected daily. According to the data in the US Vaccine Adverse Events Reporting System, approximately 40.6 cases of myocarditis per million second doses among males and 4.2 cases per million among females have been reported as of the 11th of June 2021 in persons aged 12 to 29 years of age who received the mRNA COVID-19 vaccines. For persons aged over 30 years of age, the reporting rates were 2.4 and 1 per million second doses, respectively, for males and females. Importantly, for the young people who are developing disease, most cases are mild and individuals recover often on their own or with minimal treatment. Such cases are treated with pain medications and anti-inflammatory medications. A statement by Dr. Mitchell Elkand, the president of the American Heart Association. So although myocarditis has been seen in the past with other vaccines, such as for the smallpox vaccine, the exact connection is still not clear. But the new emerging case reports are offering us clues that show that the answer probably lies in the body's triggered immune response. And so, with all the associated risks taken into consideration, the Centers for Disease Control continues to recommend COVID-19 vaccination for all young adults given the risk of COVID-19 illness and related possibly severe complications, such as long-term health problems, hospitalization, and even death. The experts are saying that the all-known and potential benefits of the COVID-19 vaccination far outweigh the known and potential risks, including the possible risk of myocarditis or pericarditis. They have also said that most of these patients with myocarditis and pericarditis who received care responded well to treatment and have quickly recovered, and so there isn't a need for panic. And that brings us to the end of this video. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. If you would like to help us make better videos and content, you can also donate to us via PayPal. Take care, and thanks for joining me today as I explored myocarditis and pericarditis following vaccination with COVID-19 mRNA vaccines.